Is testosterone replacement therapy safe? I get this question all the time when it comes to TRT. Is it safe? What are the risks? What are the downside or potential complications along with TRT? We're going to talk about that today. I'm Dr. Tracy Gapin, board certified urologist, men's health expert, and the founder of the Gapin Institute, where we help high-performing men like you achieve peak performance in every area of your life. So let's look at what are the side effects or complications or risks that go along with testosterone replacement therapy to answer the question, is it safe? One of the most common questions we hear is it associated with prostate cancer? Well, watch my other video on the relationship between testosterone levels, TRT, and prostate cancer, where I talk all about the science behind that answer to that question. And the answer is no. TRT does not cause prostate cancer. In no uncertain terms, we have clear literature that shows us that TRT does not increase the risk of prostate cancer. And in fact, men with low T may actually have a higher risk of developing prostate cancer, which is very counterintuitive, right? Next is cardiovascular risk. You know, we hear a lot of talk about the correlation between testosterone as it relates to cardiovascular health, the risk of having a heart attack, a stroke, a blood clot, and even death. I go through this in another video as well. But the short answer is we know that men with low testosterone have a markedly increased risk of developing cardiovascular disease, heart attack, stroke, blood clot, or death, and that we know that when we give testosterone replacement therapy, it reduces that risk. And so to answer the question, does TRT cause cardiovascular disease or increase cardiovascular risk? The answer is no. In fact, it actually reduces that risk. And so we know that it's safe as it comes to cardiovascular health. The other thing we hear about is testosterone may cause you to have high estrogen levels. Well, yes, in some men, testosterone converts into estrogen, and that you may find that as your testosterone level goes up, we may see an increase in your estrogen levels as well. We can deal with that. We can fix that. We can correct it. That's not a reason to not address testosterone. And so for a lot of men who are hesitant or reluctant to start TRT because of concerns around estrogen, there are a lot of ways that we can regulate and control your estrogen levels to keep them where they need to be. The caveat here is that estrogen is actually not the enemy. You need optimal estrogen levels for cardiovascular health, for sexual function, for energy, for a lot of other reasons. Estrogen is actually beneficial for us. And so testosterone causing increase in estrogen levels is really not a concern. Now, the other thing I hear with TRT is that once I start it, I have to be on it forever. Well, let's look at it this way. If you're starting TRT, the reason you're doing that is because your body is not making enough, right? And we talk about this in other videos, why your body's not making enough. It's toxins in the environment. It's nutrition. It's micronutrient deficiencies. It's lack of physical activity. It's stress. It's actually genetics from your parents and grandparents and so on as well that have created this, what I call testosterone epidemic. But suffice it to say, you're taking TRT for a specific reason because your body's not making enough. When we supplement TRT and get you to where you need to be, the question changes very quickly for almost every man, and that is, you're not going to make me stop this ever, are you, doc? I don't have to stop this. Can I stay on this forever? And the reality is that once we get your testosterone levels where you want them to be, where they need to be for optimized cardiovascular health, not to mention quality of life issues, then you're not going to want to come off of it again. And so the answer to that question is, yeah, you're going to want to stay on it forever. And if you do stop TRT, be comforted, I guess, in knowing that your levels are going to go back down to the crummy levels they were in the first place. No harm, no foul. But the key is that if you're starting TRT, it's for a reason. It's because your levels are low in the first place. Now, the other issues we hear with TRT is the risk of acne. And yes, some people do get acne with TRT, especially on the chest or the shoulders or the back. And there are ways that we can control that as well. There are medications and supplements that we can use to help regulate those side effects that you may tend to get. Sometimes you can see swelling in your legs. The same thing. There are adjustments to dosing that we can do if you notice some lower extremity edema as well. And so those are the main side effects or risks that we hear about when it comes to TRT. It does not increase your risk of prostate cancer. It does not increase your risk of cardiovascular disease. It does not cause harm when it comes to estrogen, although we need to follow those levels. It may cause some side effects like acne or lower extremity edema or swelling, which we can regulate. But what we know is that TRT, it improves your energy, your cognitive function, your focus, your mental acuity, your memory, your mood, your energy, your metabolism, your bone health, your ability to build muscle, your ability to recover from injury, from illness, your ability to burn fat, your ability to have the drive that you're supposed to have, your ability to have sexual performance like you're supposed to have, your ability to feel like a man. And oh, by the way, it reduces risk of cardiovascular disease long-term as well. And so the way I see TRT is massive, massive upside, some minor downside to be aware of, but nothing that would preclude you, in my opinion, from starting TRT. Work with your doctor. Work with Gapin Institute, work with someone who knows what they're doing for proper dosing, but suffice it to say that testosterone replacement therapy is safe when it comes to men's health optimization and performance. So if you're ready to optimize your health and performance, check out gapininstitute.com/launch for a bunch of peak performance gifts and learn more about our precision medicine approach. Don't forget to hit the like button below, subscribe to this channel for more evidence-based insights on optimizing your health, and I appreciate you watching. I will see you in the next video.